Demand on your care, medication management for older adults.
How to take medication on an empty stomach.
This medicine should be taken on an empty stomach. This medicine should be taken before meals, and this medicine should be taken after meal. When should I take these medicines?
Different medications require different methods of administration. Some medications need to be taken on an empty stomach, but many people mistakenly believe that taking them before meal is the same as on an empty stomach. This is not correct. Taking on an empty stomach means taking medication 1 hour before a meal or 2 hours after a meal. Taking medication on an empty stomach helps prevent interactions between food and certain medicines, which can affect their effectiveness. Common medications that should be taken on an empty stomach include some medicines for osteoporosis, such as alendronate. Because they are not easily absorbed by the stomach and intestines, taking them on an empty stomach ensures their effective absorption. Additionally, medications for controlling Parkinson's disease, such as levodopa, interact with high-protein foods, reducing medication absorption and efficacy. Therefore, they should be taken 1 hour before a meal. If the drug label states, "take before meal," it means taking the medication 15 to 30 minutes before a meal. Some medications are related to the digestion or absorption of food, so they need to be taken before meals. For example, anti-diabetic drugs, gliclazide, are recommended to be taken during or 15 to 30 minutes before meals to synchronize with the absorption of sugar from the meal, maximizing their effectiveness. Another example is certain gastrointestinal medications, such as pantoprazole, which should be taken 30 minutes before a meal. Taking them before a meal allows the medication to reach its peak concentration after eating, achieving the best inhibition of gastric acid. In addition to taking medications on an empty stomach and before meal, some medications need to be taken after a meal. Generally, taking medication after a meal means taking it within half an hour to an hour after eating. Some medications can be taken with a full stomach to reduce gastrointestinal discomfort and other side effects, such as aspirin, non-steroidal anti-inflammatory drugs, and steroids. Furthermore, the ideal way to take medication is with plain water. Different beverages such as milk, coffee, alcohol, and grapefruit juice may affect drug efficacy and even increase side effects. After taking medication in pill form, it is advisable to drink enough water to prevent the medication from sticking in the esophagus. In summary, older adults should follow the instructions on the drug label and take their medication at the appropriate time. If you have any questions about how to take your medication, you can consult healthcare professionals and pharmacists for guidance.
Please visit our website, Facebook, and YouTube channel for more information on elder care. Before you leave, remember to like and subscribe our channel.